To measure hip adduction range of motion using a goniometer, the patient is supine, with the lower extremities in the anatomical position. During the measurement, the axis of the goniometer is placed over the ipsilateral anterior superior iliac spine. The stationary arm is aligned with the contralateral anterior superior iliac spine, and the moving arm is aligned with the anterior midline of the ipsilateral femur, using the midline of the patella as reference.
Ms. Smith, I'm going to measure how much you can move your hip using this device. Let's bring your arms across your chest like this, and bring this leg out of the way like this. When I ask you to, I want you to move this leg in like this. Keep your toes pointing up. I need to touch parts of your hip and bring your shorts down. Is that okay?
Yes.
Okay, now move your leg in. Hold it there.